So I will explain you what are the challenges from a quality and regulatory standpoint. First of all, we are a new company, starting only 3 years ago. So we are still in the process of having our quality compliance with the authorities. So you have to know that we started from scratch. So we had nothing. We built the plant, all the plant. We buy all the equipment, and we had to implement all the quality manufacturing system. So how did I do to implement this process? Based on my long experience in the pharmaceutical industry as a responsible pharmacist, first of all, I took all the GMPs, and for each topic, we identified the needs. For each needs, we wrote the procedure, all the operational documents. Then we define our validation master plan in order to qualify all our equipments, all our buildings and utilities. Then we started the process validation, and after having produced our 3 validation batches, we started the formal stability studies needed for the regulatory process and for the next step, having a CEP. For the quality control, it was the same. Started from scratch. We only had some rooms without any equipment. We buy all of them. All were installed and qualified as for the production equipment. Then we have to test the methods, do the analytical validation, and all the analysis. Then now we have 2 challenges with 2 different authorities. First, the ANSM, the French authorities, and the second one with the EDQM, the European Directions for the Quality of Medicines. The first one for France deals with the manufacturing site compliance and then to have the GMP certificate. And the second one deals with the compliance of the product, the quality and compliance of the product, to have what we call the CEP, so the Certificate of Suitability to the European Pharmacopoeia. For the ANSM process, it's a long process, and it's based on the self-disclosure. So we have to apply for the file, and after that they need around 60 days for the assessment of our dossier. If all goes well, we will have an inspection 60 days later. And after this inspection, we will receive a report, probably with questions that we need to answer within 15 days. And after this process, we will gain our certificate. So it will take around 4 or 5 months for the base case. For EDQM, it's much more longer. We need to write what we call the ECTD. This is the dossier that describes all details about the raw material, from the development to the industrialization, so a lot of information is needed. So after the file application, only the assessment will last 23 weeks. After that, we will have a first step with the first set of questions. Depending on the assessor, the quality of the data will provide. It will take around 44 weeks. Maybe the second step with the second set of questions is not mandatory, but if it happens, we will have more additional weeks, 30 additional weeks. So that's why before having the CEP, it will take around 18 to 2 years. 18 months, sorry, to 2 years. However, thanks to those 2 processes, we can guarantee the quality and the purity of the materials. First, with the environment in which we work, because with the GMP rules, we have hygiene and dressing rules, of course. Our production area is classified, so this is a controlled atmosphere, monitored. We have cleaning procedures, precise manufacturing instructions for the operators to be reproducible. All the quality processes are in place, such as deviation management, change control, complaints, batch record, training, of course. The principle of data integrity is in place. We control all our raw materials, the finished product, and all our utilities, so the purified water, the gases, compressed air, the water, and of course a maintenance program for all the equipment. And for the CP process, for the quality of the final products, when you have to write a CP and for the assessment, it is focused on the purity of the molecule. So there are lots of questions or lots of data to provide to demonstrate that the material is pure. So first, for the starting materials, you should have analytical specifications for the raw materials, reagents, solvents, with a clear impurity profile and justified purity profile. The quality of water, of course, is detailed. You have to demonstrate that your process is able to remove all the impurities and to reduce the risk, because sometimes you have some impurities, but you have to reduce the risk to have uncontrolled impurities. Impurities usually detail most of them, so we have to demonstrate that residual solvents are low, nitrosamines also, elemental impurities among all. And also you have to demonstrate that your monograph, this is the way you control your material, is suitable to control the impurity. And then the CP process guarantees also the transparency with our customer. This is a new requirement dated in 2023 with the reinforcement of our responsibility as CP holder. It means that we have to share information with our customer to guarantee, because our customer produces a finished product for final users. So we need to guarantee the quality, safety and efficacy of those medicines. We have quality agreement signed with our customer to define what type of change we need to communicate. And if we need pre-approval from our customer before implementing our changes. We need a lot of transparency in case of failure and quality issue to be sure that the customers are informed in time of any quality issue. And the data integrity principles, maybe you don't know that, or this is what we call the ALCOA principle. It is based on attributable, legible, contemporaneous, original, accurate, complete, consistent, enduring, available, sustainable. This is the definition of the GMP to be sure that all records are well controlled.